Welcome to Nonprofit Stories, inspiring tales from Silicon Valley. We will explore the transformative work of nonprofit organizations and leaders who are changing our community by tackling some of the most pressing issues facing Silicon Valley. So without further ado, let's dive into this exciting conversation. Today, we welcome Tessa Reynolds, Rehabilitation Counselor of the Q Corner. Their mission is to offer free, accessible support services for the 2S LGBTQIA+ community, enhancing the capabilities of providers, educators, families, and community members to assist both the 2S LGBTQIA+ population and individuals using drugs. Thank you to our sponsor, TradeMyHome.com, for their community commitment and for making this podcast possible. In Silicon Valley, 40% of the 2S LGBTQIA+ community reports higher substance use rates compared to 28% generally, with 50% also facing mental health challenges, stressing the need for integrated treatments. However, only 15% of addiction treatment centers offer 2S LGBTQIA+ specific programs, highlighting a critical gap in specialized care for this community. And now your host of Nonprofit Stories, Dee Kiso.
Welcome to the show today. You're going to be really glad you tuned in because today we have Tessa with us from the Q Corner, and she's going to fill us in on the latest crisis in Silicon Valley and what is happening to alleviate this problem. Welcome to the program.
Thank you. Wonderful to be here. My name is Tessa. I use she, they pronouns. I work for the Behavioral Health Department of Santa Clara County. And I appreciate you using the language of crisis, right? And when we're talking about fentanyl and how it's impacting folks in our community, I generally hear epidemic a lot, which irks me in spaces because epidemic is really talking about a communicable disease that is spread throughout communities. And we're in a crisis right now, and we have been for about over a decade with fentanyl and it being in our drug supply. So I appreciate, you guys taking the time to learn more and help folks educate themselves on this topic.
Well, we appreciate the work you're doing. So tell us what's going on in Silicon Valley with this drug right now.
Well, this drug is definitely very sensationalized. It's been the one that's really in the media, and there's good reason for that. And then there's also misconception for that, right? The good reason is it is a very potent opioid, and it can have folks in overdose and poisoning states quite often if they are not educated on how to use it or knowing that it is in their drugs. So here in this area in Santa Clara County, it's impacting all communities. It's impacting the disenfranchised communities. It's impacting affluent communities. We're seeing, a lot of young people that are using pills that are being adulterated with fentanyl, and they're having adverse reactions to it, which can also include death, which makes it, a very alarming rate of young people that we're losing within our communities that are experimenting with substances, in addition to our unhoused communities, in addition to anyone could really be susceptible if they're using substances at this time in our county.
So how is fentanyl finding its way into other drugs?
Well, there's multiple theories, within the community. The theories are drug dealers are putting them in there, which is possibly true. There is folks that do tend to want their substance to be stronger or better than another person's. There's ways that it can be put in accidentally, like cross-contamination with folks that are dealing, and maybe they're dealing fentanyl and then another substance where they're cutting it up on the same table. There's also theories, of other countries bringing it into our country in order to harm our citizens, so there's a lot of theories, but the most prevalent would be, people trying to make their substance a little more potent than the other, which I kind of look at, and it's very similar to any industry. We can look at the food industry, right? We don't use cane sugar because maybe it costs more. So we use fructose corn syrup, which is a maybe not as healthy option, but it's cheaper and it can go into a lot more food products and people can eat them at their own risk, maybe have other health complications, in the future. So it's really kind of within when we look at, mass industries, like let's say the drug industry, that can be how they're trying to make their product cheaper and better and affect more people at one time. So which doesn't make it okay considering the potency for it. Thank you very much.
So has the rise in fentanyl created a different urgency for the people in your organization and your work?
I think it has, because we have seen an increase in overdoses and poisoning events, in this area. Luckily, the majority of fentanyl is being placed into heroin, which folks that are using opioids may already have a tolerance. I'm not saying they're not susceptible to overdoses and poisonings. However, that could really help safeguard their system because they are tolerant to opioids. It's really fearful in the other communities, like folks that may want to party on the weekend and use cocaine, and they're not aware of what's going on in our drug supply currently. So it has brought us to really, for our program generally, the Q Corner, we built out what's called the Harm Reduction Project, which actually addresses this issue solely in terms of getting out naloxone distribution, helping folks have access to fentanyl testing strips so they can test their substances before they consume them to see if the presence of fentanyl is in there. And we just create safe spaces for folks that use drugs to come in within the LGBTQ plus community and access services and know that they have a space where people will listen and care for them and really meet them where they're at in their process of change.
What are some of the critical challenges in addressing this fentanyl crisis with a harm reduction perspective?
That's a great question. Thank you. One of the critical challenges with addressing any type of substance use is stigma, right? We have and criminality, right? Where we really criminalize people that use drugs. And unfortunately, we don't criminalize all drugs, right? We have access to alcohol, which folks can go and consume, which I really like to bring into this conversation that, we're really hesitant about safe consumption sites and overdose prevention sites in our communities. However, we have them. They're called bars. I could safely go into a bar. I can consume alcohol. I can have somebody help me out, so just really showing that, these spaces already exist for certain types of people that use certain types of drugs. So for what I really see is that stigma, right? Even with trying to provide someone naloxone or fentanyl testing strips, it's assumed that that person may be taking those products or those, those safety nets in a sense, or the first aid, however we want to refer to, naloxone, is assumed to be a drug user, right? And that's what's really unfortunate, because I always tell people it's kind of hard to give yourself naloxone when you're unconscious. So, we get a lot of folks that will be like, oh, I don't really need that. I don't hang around people like that. And then again, just in those languages, that's stigmatizing a certain group of people because we don't know, who's ingesting substances, what they're ingesting, and how much they're ingesting. So that is probably the biggest challenge that I think we're fighting in the global scheme of things is stigma for people who use drugs, and really making spaces accessible for folks to talk about it. When we criminalize an activity, it makes it very unsafe for people to go access services and access help, because therefore what the activity they're doing is deemed illegal. A young person may not want to go talk to a caregiver about getting fentanyl testing strips if they're experimenting with substances, because we don't want young people to use substances, understandably, but we also know that young people and all types of people will use substances. So really just making a global effort to destigmatize people that use drugs and really look at the policies that we have in place in our country that keep folks that use substances down. Because when we're talking about folks that are dependent on substances and really in that chaotic use of substance use, that's 10 to 15% of people in our country that use substances. But that's what we focus on, right? This 10%, this may be, the outcome, which could be true, but we're missing this whole 85 to 90% of folks that use substances without consequence in their life, right?
So is the LGBTQ community more susceptible to fentanyl and overdose? And if so, why?
Yes and no, right? I would say no, particularly because anybody that is ingesting substances at this time could be susceptible to coming in contact with fentanyl, having an overdose or poisoning event. But specifically for the LGBTQ plus community, it's not only susceptibility to higher increase of substance use due to trauma and discrimination and having lack of spaces to access within our communities. And that's really why, the Q Corner has come about, is to really create these spaces and help other places within our county understand that all people of all bodies and all types should be welcomed. And in addition, it increases houselessness and folks becoming unhoused due to maybe coming out to their parents or, being a part of the trans community and, being ostracized by their family. So it does create a whole nother level of susceptibility. But again, I don't want to say that the LGBTQ plus community is more at risk, considering anyone is at risk if they're ingesting substances. But thank you for that question, because there are some, differences within the LGBTQ community that do impact the trauma and impact the way that people are able to even access services within our community.
You're somewhat known for your work in a film that's very informative. Tell us about that so we can all hear about it.
I appreciate you, knowing that and bringing that into this conversation. So yes, I was a part of a film about Dr. Gabor Mate's life, and he is a physician that works out of Canada. And he did a lot of work within the trauma community, within the substance use community. He helped initiate the first safe consumption site that we have in, I don't think he helped initiate it. He worked at one of the first safe consumption sites in Vancouver called Insight as a medical doctor. So a group of folks saw the impact that he was having on people that worked in trauma-informed services, that worked, as substance use providers like myself, and said, I need to make a movie about you. So I was lucky enough to be a part of it because I've been working, through his eyes and the work and the teachings that he's brought into the community for people practicing in harm reduction settings and people that are just highly traumatized and, living on our streets. So it was really impactful to be a part of that and to bring that into, a global community. It was viewed in, I think, almost every continent. It's, translated in 17 plus languages. So it's very accessible for folks, online, and I can give you some more information about that.
I'd like to turn now to how you're using Narcan to prevent fentanyl overdoses. Can you bring us up to speed on that for those who aren't familiar with it?
Well, thank you for asking me that question. So what we do, we have a lot of mass distribution programs that we have within our county, us specifically at the Q Corner. We tend to do a lot of tabling events at colleges and other health fairs. We have drop-in hours where folks can come in and easily access it. We have access to fentanyl testing strips, and I really like to bring that in conversation because when I'm in trainings, I say, if we use these fentanyl testing strips, it might be unlikely we have to use naloxone because people are knowing what they're ingesting, right? If they're buying what they believe is cocaine and there's fentanyl in it, it would be nice for that person to know there is, just in case if they see a positive test, they might not want to take that substance anymore, knowing, the potency of fentanyl and how it can affect people's system if they aren't tolerant to opioids. So we use it, making sure that any age has access to it. It can be used on infants, it can be used on adults, it can be used on elderly folks. It can work on anyone because it's specifically, again, to just bind to that brain receptor. But I do want to also highlight that there is an unfortunate part that can happen after you administer naloxone to somebody, is that like any medication, it will wear off in a matter of time, right? And the medication can stay on that receptor in somebody's body for about 30 to 60 minutes, which if we don't elicit EMS support and we have folks maybe get medical attention after reviving them from an overdose or poisoning event, they can have what's called a secondary overdose without even ingesting more substances, because at that point, the opioids have not had time to metabolize outside of our body. And as soon as that naloxone goes off of the receptor, those will just reattach to the opioid receptors, which could, again, cause another overdose. So I really, we do a lot of education. So I thank you for letting me take some of this time to educate the community on the things that folks didn't understand or know about naloxone. Like a couple weeks ago, we just heard of one of these events, right? Because their friend didn't want to go with the emergency providers, so they went home and then they passed away at their home because the person that revived them wasn't aware that that can happen. So we just really like folks, to have all the information and then they can do what they like with it.
So how effective is this in reversing opioid and fentanyl overdoses?
It's completely
100%.
Effective. Yes. If you can get to that person in the amount of time, and your naloxone is, I don't want to say expired because they can be used after being expired, and you know how to use the naloxone properly is what I meant to say. You can save somebody's life. So that's why we do a lot of training events. We want to make sure that folks use it as quick as they can, because any person that doesn't have oxygen to their brain, if they're, having another medical emergency or it's opioid related, their brain can start to suffer, within about 5 minutes of lack of oxygen. So, we've had folks that were revived, but they still had complications. They still have other elements that they have to live with day to day because of the amount of time it might have taken for somebody to get to them with naloxone. So that's why we're very urgent on making sure parents have it, children have it, and I say children mainly too, because there could be, a grandparent that's taking opioids for pain medication and they take too much, and mom's out shopping and the kid's home watching, or hanging out with the caregiver, and then they aren't responsive. They could simply use this medication. I have it here, this medication, and insert it into that person's nostril and use it and call 911. And that can really help with getting this medication into someone's body quicker, right?
Mm-hmm.
So very effective.
What is Santa Clara County doing to increase the awareness and access to Narcan?
I'm actually very proud of Santa Clara County because there's a lot of efforts going on right now. We have a lot of committees. There's one particularly called the Santa Clara County Opioid Overdose Project, and that is formerly or also known as SCOOP. So they do a lot of naloxone distribution and fentanyl awareness talks. We have the Sexual Health and Harm Reduction Program, which was formerly known as the Needle Exchange Program, and that's been a part of Santa Clara County systems since 1990s. So they've been helping folks get access to harm reduction support, through safe syringes, naloxone, fentanyl testing strips, safer smoking supplies, to really help folks at the public health level understand that when we give these tools to folks, they're less likely to maybe share supplies and can continue to increase communicable diseases. They're less likely to commit crime in order to get access to supplies they need. And then ourselves at the Q Corner, we've developed, like I said, the Harm Reduction Project. So that's another effort. We have the preventions team with the substance use division. They're doing a lot of marketing. You can go on buses and VTA and you can see some of the billboards and stuff that they've put out there in terms of marketing. In addition to focus groups, right? Really asking folks, like the young people, particularly with a lot of the counterfeit pills going on right now, what do they need? What would grab them and their attention and their peers in order to understand this information, right? Because we've seen, historically the Just Say No campaigns, they worked for some, right? But not a lot. So there's a whole new effort of Just Say No, KNOW. Know what you're getting into. Know how to use these substances. Know how to respond if somebody, is in distress. And then in addition, like making naloxone training videos that we have available for folks to view on their own time and understand. And, there's a lot of efforts going out. And another one I would love to highlight is vending machines. So there's a lot of naloxone vending machines coming throughout Santa Clara County. The first ones were in the jails, Main Jail and Elmwood, which is really amazing because we know that when folks do become incarcerated and they are opioid users, when they're incarcerated and they're not using, their tolerance will deplete. So as soon as they exit incarceration, they are way more increased rate to having overdoses if they go back into using substances, right? So really knowing that they can get this as they leave jail, or they can get it for a friend, or you could walk in there and grab, and then as well as community colleges. We have a lot of colleges that are getting the vending machines on site so their students have access to them. So there's just a lot of great efforts coming, within the county and helping folks get access to naloxone and fentanyl testing strips and support, right? And really being able to have these conversations with people and help them understand what is needed once somebody is revived from an overdose, because it doesn't stop there, right? That can be the start of a journey. That can be an interruption in someone's journey. It really is individualized to folks. So thank you for that one.
A typical problem homeowners have when wanting to buy a new home is whether to sell first or buy first. Either way is risky. When ready to look for a new home, TradeMyHome.com, powered by Your Home Sold Guaranteed Realty, offers an upfront guaranteed cash offer on your current home. Are you moving in the next 3 to 6 months? Text PAIR to 408-740-7400 for a free and no obligation professional equity appraisal report, exclusively for Nonprofit Stories podcast viewers. For more information, visit TradeMyHome.com or call 408-740-7400. Remember, at TradeMyHome.com, your home is sold guaranteed or we'll buy it.
You're welcome. So we both are in on this. I've worked in this industry as well, and currently still have my toe in it. I don't know about you, but I've heard of people saying, well, you're just using this to give them a second chance. So there's these naysayers, these people who are saying, well, why do we even have this available? Or does this encourage young people, all people? Yeah. What do you say to that?
Well, what I say to that is, again, anyone can be susceptible to this if they're engaging in substance use. And what I say to that is we need to look at folks with care and compassion, and we need to help understand that folks aren't using substances in our community because maybe, well, let's be real. Drugs make people feel good, right? So a lot of people use drugs because it makes them feel good. But again, it's that 10%, 15% of folks that we really focus on that are the quote unquote hardcore drug users, right? But that is perpetuating stigma. That's saying this group of people is this type of person and this group of people is this type of person. I'll go even as far as saying, just from growing up in this country and learning different language that we talk about people, have you ever heard somebody come in and say, I overdosed on alcohol? Have you ever heard someone come in and say, I was poisoned by alcohol, I had an alcohol poisoning, right? So even with that language, we're already saying, for me, correct me if I'm wrong, what I hear when I hear of a poisoning is I think of a victim. Like no one would intentionally poison themselves, right?
Right.
And then when I think of an overdose, from what I've been taught in our country, is you should have known better. Why didn't you stop? You should have kept, you should have, all of this rhetoric that you so graciously started this conversation with. And that's it right there, right? We're already separating that alcohol seems more of like these people were victimized if they quote unquote drank too much, because we don't call them overdoses. We have alcohol and other drugs, right? So we just continue to perpetuate the stigma. And that, unfortunately, goes back to the war on drugs of when we started enacting this war on drug users is really, war on people that use drugs is how I refer to it, because we can't have a war on an inanimate object like a drug. And then why do we have a legal substance like alcohol and nicotine that kill more people in our country than the fentanyl crisis and drugs combined, and it's still sold legally, it's still regulated, it's still accessible, right? And there's a lot of racism and stigmatizing and structural violence that happened within the war on drugs, which brought us to where we are today. I mean, if you look at our prison populations, it's pretty obvious to know what I'm saying without saying it, right? We have criminalized activities that certain group of people will do so we can incarcerate, quote unquote, enslave those folks into our incarceration systems, and then we will legalize other substances. So it's very interesting, when you look at the history of why we legalized and illegalized certain drugs, because it didn't have much to do with the safety or, this drug is worse than this drug. All it does right now is it perpetuates good to bad people, right? If we talk about a certain type of drug, we're already saying those quote unquote type of people are bad, which is completely a false narrative that we continue to
and we don't have a safe community from any of this.
Exactly. And then again, with like what you're saying, the encouraging or whatnot, people are going to be curious. They're going to try drugs. We have young people that are curious. There's peer pressure. There's, drugs around. They can get them on Snapchat. They can get them all sorts of different types of online platforms, which is really scary. Their parents won't even know that they're engaging in this stuff. There's
more available than ever before.
So tell me how the war on drugs has helped, right? It's increased use. It's increased susceptibility. It's increased, accessibility, which, but again, if I look at it from a side of it where, I'm gaining income or I'm gaining money from incarcerating people, it's a huge success, right? It's just what side are we looking at it from? I'm looking at it from, the folks that are really disproportionately impacted by the war on drugs, which are the people that use drugs,
Right. So then how about a success story? What is that one story that pops into your head where Narcan saved somebody?
Well, I hear them all the time, quite honestly. Narcan saves people every day. We hear about it like when I worked at the Sexual Health and Harm Reduction Program, the Sharps team with Public Health, one of our questions when we ask folks when they come in is, have you used our Narcan to reverse an overdose since last time you were here? Most likely people say yes, right? Because they are actively using naloxone, Narcan, in order to help people survive in our community. And they just want to tell you the story, right? So they'll say, oh, last week, this and that, and and it's beautiful because they want to connect and they want somebody to hold space with them in those moments that are very scary and can be very traumatic to revive your friend, from using a substance. But particularly when I think of success stories, I think of anyone that gets naloxone and survives. And even if they continue to use drugs, they're given a second chance, right? And sometimes that can be an interruption in their substance use journey. And they might say, you know what, I'm not going to do this. Particularly, I have children and I make sure that they're educated about these products. And I had my teenager show me a text that one of her friends sent her that said, thank you for the fentanyl testing strips. My pill was positive. You saved my life. Like, these are things that are really happening in our community day to day. And I was so happy and proud, first, that she came to me with that information. She came to me to ask about, these tools to help keep her friends safe, because she's a high schooler and people are experimenting, and it's unfortunate that, this is where we're at in our country, because when I was experimenting, I didn't have to worry about really, is my friend going to live through this tonight? I had to worry, are my parents going to catch me? It was scary, of course, because you don't want to be in trouble, but it was not this type of situation that we have today where we really need to make sure we're educating folks. We're giving them the proper information and we're not misleading them into saying, don't do it because it's bad. That's not going to work for a lot of folks. So thank you for that.
You're welcome. What strategies are you using to educate the community in when is this a fentanyl overdose and the importance of carrying Narcan?
Yeah. So the strategies we're using, I shared about, is really a lot of robust trainings and trying to get folks to know about naloxone. For the Q Corner, follow us at the Q Corner because we're on Instagram, and that's where we put out a lot of our promotional material. We make a lot of pamphlets. We help folks understand really, there's a fine line between somebody that is an opioid user and they're enjoying, they're high at that time, and somebody that is actually experiencing an overdose or a poisoning event. That's if they're breathing or not, right? So if somebody is conscious and you can say, hey, I've got naloxone, you need it? And then, no, I'm good. They don't need naloxone, right? So we can really see that when we're educated, we know when to properly use it and how to use it. And in terms of other strategies, it's talking with folks, right? It's connecting with people. It's making sure we have those spaces where folks are comfortable to come in and have conversations. We have a lot of systems and a lot of programs which are great, and they help a lot of people in our community that are very abstinence-based. So instead of inviting folks in and saying, hey, you're under the influence of substances, that's okay, come in and chat with us, they're going behind our clinics and they're using behind our clinics or in our alleyways because we don't have a lot of these safe spaces in our community where people believe they can come in and be seen as a person that uses drugs in our community and be cared for, right? Harm reduction really is mutual aid. It's a public health response. There's a lot of, things that I don't think people understand about harm reduction. Like, for instance, did you know you practiced harm reduction today? Did you wear your seatbelt here to come meet with me?
Of course.
That's a form of harm reduction, So we really look at the harm reduction strategies. We're using them every day. We're following speed limits. We're putting our seatbelt on, right? So these universal ones, people are all for, they love them. But as soon as we start facing it towards substance use, that's when, the unease can come in or the stigma can come in or my children wouldn't do that. I've heard that so many times. And I'll tell you, my teenager knows your kids might be doing, so just really understanding that everyone can benefit from knowing more about harm reduction and more about how to safely use substances if they're curious or not.
So how do you address the potential barriers to getting Narcan in the community from the stigma that you might be faced with when you're trying to get this out?
Well, some of the barriers we found are liability, right? A lot of organizations or right now we're trying to really get it into bars and cafes and restaurants because we know that's a space where folks could most likely use substances. And people are worried about it, right? They're worried if they administer it, will they be sued? You can't. There's a Good Samaritan law we have in California. So there are ways that we, have kind of hot topic discussions about how can we kind of sell this product, even though it's free, right? How can we get someone to understand the benefits of having that at their business per se, having that at their school? And I just hope to whoever's above us that, when folks do decline having it, that they don't have an adversity in their life that they go, oh, I wish I would have, and those are the moments when, but I'm not here to convince you to do something or take something that you're, don't want to. I respect people's autonomy, but I really urge folks to just at least know about it, know where you can get it, know how to get people there, when they need help.
So let's talk about the myths of fentanyl and Narcan. Myth. Why don't you give us one? Well,
the biggest myth that I hear, and I have to continue to keep saying it because I keep hearing people say that it's true, is you will not die or have an overdose or poisoning event if you touch fentanyl. That is something that we have seen perpetuated by certain jurisdictions in our country. We've seen a lot of videos, we've seen a lot of media around people handling baggies and going into what they believed was an overdose response. It was a panic response. People are expressing increased heart rate, increased breathing rate. Those are completely the opposite of what somebody experiences when they are overdosing on fentanyl or opioids in general. So that is something. And the reason that we really need to make sure this myth is heard in the right way is it keeps people from responding to folks when they are experiencing fentanyl overdoses and poisonings because they think if I touch this person and they may have come in contact with fentanyl, then I could be susceptible to having an overdose, right?
So it sounds like myth number 2 is if you're helping someone who's having an overdose, you're not going to have those reactions to an overdose yourself.
Yeah. So that type of misinformation that keeps being perpetuated, it's killing people. It's keeping people, but I understand. We wanted to make it really scary. Don't touch it. If you touch it, you could die. I get that, but that's not how we work as humans, right? I work with people that use fentanyl and they're living and they see these media campaigns or they see things and go, that's not true because they're living that experience where they're like, I've touched it, I've ingested it, I've used it, right? But they know how their bodies can tolerate it. They've been educated on it. They've worked with professionals like harm reduction specialists to help them understand, what can happen to them if they use too much, and they follow protocol, right? Use slow and low. Don't start with a big dose. Have people around you with naloxone. Test your substances, right? There's a lot of great ways that we can help people be safer when they're using substances in order to stay alive.
What's myth number 3?
Myth number 3 with fentanyl. Those are really the 2 that I think I'm hitting is the touching it, or if you breathe it in accidentally, which is very similar with the touching. It's not. It's just you breathe it in and it's going to harm you, I'm not saying go touch fentanyl, go experiment with it, but I can tell you that I have sat there with a participant and we tested their methamphetamine and it was positive for fentanyl. And I dipped my finger in the water. So I can sit here and tell you that I have touched fentanyl, right? And it could have come from, I'm not going to try to justify how myths are created or not, but there are fentanyl patches that help folks with managed pain. So I can understand maybe if someone thought, oh, it can go on the skin through that way, but that's solubles, that's science. That's not, I crushed up some, aspirin and I rubbed it on my arm and my headache went away where, you have to get the stuff in your bloodstream and in your body in order for it to impact you.
How about any myths on Narcan?
The myths that I hear are really just like what you were kind of starting with. Like, it's not really the myth. It's more the why would we want to save these people? Why would we want to help people that use drugs continue to live, right? And the reality is people that engage in harm reduction services, they're 5 times more likely to maybe change their trajectory with substance use, their relationship with certain substances. And that's huge, right? We see a lot of, other types of programs trying to help folks. And harm reduction really meets people where they're at, but not leave them there, right? Really trying to help them move through these stages of change. And if they want to be in a different space, they can be. If they want to be right where they are, we'll accept you where you are. You're still a human being. You're still worth something. And the way that, it's a quote by Gabor Mate, which I love, which he brought into my thinking was, it's not the drugs and the alcohol that are the problem. It's somebody's best attempt to solve their problem. So we're living in this country going, stop the supply, let it leave. We need to really focus on the demand. Why do we have so many people in our country in pain that want to take opioids, to not feel the way they are, right? This substance use, this is a response to human suffering. This isn't because people that are just, I can go on, but I know we want to keep our audience happy and healthy. So let's keep moving forward, please.
So how are you collaborating with law enforcement, healthcare workers, community? What does that look like?
What it looks like, we collaborate a lot with healthcare professionals and other communities, schools, and really partnering with getting naloxone out and making sure we're messaging the right information out there, With harm reduction, it's really challenging to partner with law enforcement, quite honestly, because they're coming from that punitive way of what they deem the folks, that we're trying to help survive are doing is illegal. So, of course, they have their job and they have to, do what they have to do in terms of what our laws say. But that's where it can kind of be really challenging to partner with them, considering a lot of harm reduction is really trying to change drug laws and really trying, to look at like the drugs we have on the Schedule I and seeing like there is a lot of medical, components in psilocybin mushrooms and MDMA ecstasy. We're seeing this stuff studied right now. But again, they're still illegal. They're still on a Schedule I, which can be, really challenging to work with certain jurisdictions. But, I'd be open to it if they were open to trying to, figure out how we can work together on the same solution. Because, a harm reductionist that, I really look up to, she made a video and she said something to the effect that we label and we define addiction with consequences, and we also try to treat it with consequences. What other disease do we label with their symptoms and then try to treat with their symptoms? And I thought that was really powerful because that's true. We have the same, if you're, quote unquote, the, DSM addiction, substance use disorder diagnoses is consequences, legal, social, relational. And then again, what happens is someone's caught with a substance, they get more consequences. I don't understand when we think, people living, in our streets, injecting substances and they're not already at a bottom and we think they have to hit bottom. Like we need to help bring people up from the bottom. We need to really meet people where they're at and help them, achieve their goals and dreams that they want and not continue to stigmatize and separate and, traumatize certain groups of people. Because again, it's not happening to all groups of people. And you've lived in this country with me. You know what I'm saying. No.
Right. What is it that every viewer can do now to help you in this fight?
What we can do is you can please tune into the video that we started this session with and learn how to administer naloxone and contact us when you need a box. Also, you can contact the Santa Clara County Opioid Overdose Prevention Project, SCOOP, and they can mail you a box. So, right, we want to make sure that people know this stuff is available. It's over the counter, but it's really pricey. We have access right now in our county to get it for free, to send it for free, to make sure people have it. And please help others understand the misinformation when you hear it and just, sit down and talk with someone that uses substances and see what they're like, and really continue to foster healthy relationships and connection within our community with people that use drugs and all types of people in our community.
And how might we find those fentanyl strips? I would think our parents would all want that.
Thank you for asking that. You can find them through our program at the Harm Reduction Project. You can find them through the Public Health Department. You can find them online. That Dance Safe has a very good brand that was specifically designed to test substances. Drugs, the other ones were actually urine tests. The harm reduction community really scrambled to find a way to help keep people safe, so we were using those in the beginning, but they were creating a lot of false positives. So the Dance Safe ones are specifically to test drugs, and they have had 0 false positives if they're used correctly. I do also have to say, make sure you have naloxone when you test your drugs, even if they're negative, because they can't keep up with all the analogs of fentanyl being mass produced in our country with different chemicals. The test can't be produced fast enough to keep up with the way the drugs are being produced. So we always say, keep naloxone on you and test your substances before you use them and talk to safe people, that have experience And if you're interested in moving into a different stage, reach out to us. We have wonderful programs within Santa Clara County for withdrawal management, for abstinence-based services, family services. So really knowing that, there's a lot of programs out there that can help you or your loved ones, if they're struggling with substance use issues within their life.
Great. I just want to thank you so much for coming, educating, and elevating us so we can make the county a better place and beyond.
I appreciate that. Thank you so much for your time and your hospitality with, coming into your space.
You're welcome.
Here's a sneak peek of the next episode of Nonprofit Stories, featuring Rhonda Norris, the executive director of the Happy Hollow Foundation.
I grew up in a family that really valued giving back to the community. And although we weren't rich in treasure,
they aim to support conservation, education, and play for innovative programming and strategic fundraising.
At school and the community, that's something that really stayed with me growing up. And it really started to resonate with me, that the idea of fundraising, when I became a parent. And I got to volunteer.
Check out our next full episode on Wednesday at 5 o'clock Pacific and 8 o'clock Eastern on YouTube and Apple Podcast. Thank you for listening to the podcast and acknowledging the impactful work of nonprofits in Silicon Valley. Please subscribe and share this episode with a friend. Thank you to our sponsor, TradeMyHome.com, for their community commitment and for making this podcast possible. Until next time, remember to support local nonprofits.